I'm Dr. Freddie Gomez, and you're watching The Doctor Is In. We're your guide to health and wellness in this time of COVID 19. Our topic for today: allergies. Sometimes some of you might have a hard time distinguishing allergies from symptoms of COVID 19, and we're here to help. Joining us on the program today is family physician Dr. Limuel Abrogena. He's also an assistant professor at the Ateneo School of Medicine and Public Health. Welcome to the show, Doc Limuel.
Good afternoon, Doc Freddy. Good afternoon to our viewers.
Now, allergies are very common. People who suffer from allergies have itchy eyes or itchy noses, and they start sneezing or even coughing. In some cases, people even have rashes or swelling. Others also experience asthma and have a hard time breathing, which is also a symptom of COVID 19. How do we differentiate the two? What do you think, Dr. Limuel?
Doc Freddy, it is very difficult to differentiate in terms of symptomatologies. If you remember, kapag kami COVID-19 po tayo, yung mga simptomas na makikita natin yun, katulad ng sinabi ni Doc Freddy, dry cough, okay, sipon, and then difficulty of breathing, which are also typical symptoms of patients with atopy. The main differences, of course, is kung saan nanggagaling itong mga simptomas na to. Of course, if you have COVID-19, the virus, okay, so it would cause you the symptoms that we have mentioned. And then if you're an atopic individual, you would also experience these initial symptoms when you are exposed to an allergen.
All right. So, and again, it's worth reminding our viewers about some of the symptoms of COVID 19. So, there's flash on your screen. So, if you have any of these symptoms, please seek medical attention. Call your doctor first before seeing him or her so your doctor is aware of your current medical condition. Anyway, we want to discuss this time what can trigger allergies, which are caused by substances called allergens. These allergens will cause you to itch, to sneeze. And like we said earlier, some people experience wheezing and have a hard time breathing. So, Dr. Limwell, could you please explain to our audience what are the most common allergens?
Okay, so we start with the allergic reaction first. It is our immune system response to the allergens. Now, allergens now are the substance that causes this allergic reaction. So, what are these substances? So, there are four ways for us to be for these allergic reactions to come in our body. First, contact. So, there are sometimes na kapag ka napahiran lang ng isang bagay or kaya na-expose ka sa isang katulad ng belt, okay? So, may mga nag-allergy na. So, that's one. Second, ingestion. Kapag kami nakain, pwede ka rin magkaroon ng reaction. Okay? So, kung ang isang atopic person, nakakain po ng isang pagkain na allergy pala siya, katulad ng hipon o kaya ng peanuts, okay? So, pwede ulit siya magkaroon ng reaction. Second, inhalation. So very common, especially during the cold times, okay, yung pollen, okay, or kaya you're living in a area na maraming mga trees, so pwede kang magkaroon ng allergy dito. Another one, classic example na hindi natin pinapansin masyado ay cockroach, okay? So cockroach in a study by the University of the Philippines came out as the #1 allergen. And the last would be injection. Okay? Kunyari may tumusok sa'yo na pwede ka mag-allergy, katulad ng mga gamot. Okay? Kaya yung iba, tinitest muna para makita kung may allergic reaction. You can also have an allergic response kung kinagat ka ng bubuyog. So that's also injection in a way.
All right, now it's time to read some questions from our social media audience. We have a question from Mark Michael Hernandez. Ang tanong niya, one of the ways you can acquire COVID-19 is by touching your nose. But my nose gets itchy and stuffy when I have allergies. What can I do to avoid touching my face?
Okay. So it's very difficult, okay, among atopic individuals na iwasan yung mga ganong pagkakataon. Kasi talaga, kapag ka na-expose ang isang atopic individual, talagang nangangati at nagiging stuffy yung nose nila. And because of the pandemic, okay, so that's also a warning for us not to touch our nose, most especially. So what we do advise to our patient is that one, okay, since alam nila na atopic individual sila or mabilis sila mag-allergy, umiwas sila sa mga bagay na nabibigay sa kanila ng allergic reaction. Number two, okay, wear gloves para maalala mo na dapat hindi mo hahawakan yung mukha mo. Okay, and most importantly, wear your mask. Okay, so that would always remind you to somehow to avoid your nose and your face.
Okay, thank you, Dr. Limuel Abrogena, for joining us today and sharing your expertise on this topic. Later in the show, we'll talk about the most common allergies here in the Philippines. We want to make sure you know the difference between your allergies and COVID 19. Stay with us right here on The Doctor Is In. We're glad you could join us. I'm Dr. Freddie Gomez. We're talking about allergies, which is your body's way to fight off what it identifies as a threat. And in this time of COVID 19, we want to make sure that you don't confuse your body's allergic reaction to symptoms of COVID 19. Joining us today is Dr. Michelle De Vera, an allergologist and fellow at the Philippine Society of Allergy, Asthma, and Immunology. Welcome to the program, Doctor. Let's talk about some of the most common allergies in our country and explain what their most common symptoms are. We can start first with asthma and allergic rhinitis.
Hi, Freddie. Good afternoon. Um, if we're talking about respiratory allergies like asthma and allergic rhinitis, the two most common allergens would be dust mites and cockroach. So these are found mostly at indoors, certainly in your bedroom, your living room, things where the dust mites can actually burrow. And then if your house is infested with roaches, then that would be a common allergen as well. There are other allergens such as molds, which is pretty common in the Philippines as well, and also pollen, but that's not very common in the Philippines just so because we don't have seasons. We don't have spring where the pollen count would be very, very high.
How about food and drug allergies? What are their most common symptoms?
If it's food allergy, the most common food that people are allergic to in childhood would be milk, eggs, wheat, and soy. And then as you get older, there would be shellfish, peanuts, and tree nuts. In the Philippines, we don't have a lot of really hard data, but a lot of the patients who are allergic here are allergic to shellfish.
I want to focus this time on atopic dermatitis. Some COVID 19 patients also have rashes of different types. What's the difference between rashes and atopic dermatitis?
That's a good question because when they did studies on COVID, they found out that one of the things that it can present as would be rashes. So when you say rashes, it could mean a lot of things. It could be spots or a red patch, or it could be itchy or painful. In general, atopic dermatitis is the diagnosis. And one of the symptoms of atopic dermatitis is a flaky, scaly, itchy rash. So that's the usual presentation. Um, Itch is a very common uh, symptom of atopic dermatitis. The rash of COVID is a little bit different, and it can be, like I said, it can present as any kind of rash, but it's usually more acute. You know, they've never had rashes before, and then all of a sudden they have a rash, as compared if you had atopic dermatitis, which usually starts out in childhood. So the story would be, oh, since I was a child, I've always had a rash, this scaly, eczematous, flaky, dry rash.
How do we prevent allergies so a patient can avoid having to go through some of these symptoms of annoying and often frustrating symptoms?
That's true. It is really annoying. It's really bothersome for a lot of people. And so it's important to control your symptoms. So I guess the first thing that you want to do is to figure out what you're allergic to. So if you find out what you're allergic to, that would be easy to avoid things that you are allergic to. So if you're allergic to, like, say, a particular food, then you can avoid it. Or if you're allergic to pets like dogs or cats, then you can avoid that. So that would be the first thing. Try to avoid things that you're allergic to. The second would be to control your symptoms. So if it's itchy,
Okay, I think we lost Dr. De Vera a little bit while we're trying to get Dr. De Vera back. She was talking about what causes or how to prevent these allergies from manifesting, and one of the best ways is to identify what is causing, what allergen is causing this reaction to you. So the best way talaga is first and foremost to avoid it altogether. So you have to know what is causing your allergy symptoms and to avoid that. Um, she was also talking about some of the manifestations of that, and some of the rashes can be seen with those with COVID-19. So some of these rashes also manifest as having symptoms of itchiness. So mahirap din po, yun ang sinasabi ng ating mga eksperto ngayon. Sometimes ang mga rash, very general po ang uh, presentation po nila sa ating katawan. So when we have a rash, best is magpakita na po tayo sa allergologist or sa dermatologist. Huwag natin kaagad-agad assume na COVID-19 related po ito, pero huwag din natin i-discount or huwag din natin ibaliwalain ang mga rashes sa ating katawan. Dahil pwedeng ito ay sintomas ng isang mas malalang kondisyon. Okay? And I also want to emphasize during this time of COVID-19 that you must also, just the basics. The basics should always fall into play. Social distancing, hand washing. As we all know, the cases are still rising. Okay, so I think we have Dr. De Vera back on the line. Doctor,
hi,
can you
Freddie.
hear me?
Sorry. Yeah, I can hear you.
Yeah, that's not a problem. This is part of the new normal. So that was a good explanation on how to best avoid allergens, or they must identify first what is causing that so they can then avoid that. But doctor, one thing though is in some severe cases, allergies can trigger a life-threatening reaction known as anaphylaxis. Let's explain what happens to a person who goes into anaphylaxis and if untreated can result into anaphylactic shock.
That's correct. So the most severe kind of allergic reaction is anaphylaxis. So when you say anaphylaxis, there are symptoms that are life threatening. So symptoms like difficulty of breathing, choking or closing up of your throat, you cannot breathe, and in some cases your blood pressure drops precipitously and then you go into shock. So you can lose consciousness, and in fact, unfortunately, some people have died of anaphylaxis.
That's right. Now we're aware of the different types of symptoms of allergies. Let's talk about treatment very quickly. How do we treat allergies, doctor?
The first thing you can do is, like I said earlier, avoid things that you're allergic to. So that's the first thing. If you can't totally avoid them, then you can use medicines. to take care of the symptoms. So there are antihistamines, nasal sprays. If you have asthma, you can use inhalers and other tablets that you can use. And then lastly, there's such a thing as called allergy immunotherapy. Uh, it's kind of like making you desensitize you to whatever it is that you're allergic to. So it's a series of shots or a series of drops underneath your tongue that you can use so that at the end of the program, you become desensitized to that thing that you are allergic to.
Okay. Now, really quickly, basahin naman natin ngayon ang mga tanong from CNN Philippines Facebook page. Let's start with Phil Pahe. Ang tanong ni Phil Pahe is there a wide spectrum antihistamine, example for rhinitis, asthma, and hives, that can be taken safely over an extended period of time?
Yes, there's a lot of antihistamines right now that's available. The antihistamine is not specific for the disease. It's specific for the symptom. So for itch, for itchy nose, itchy eyes, it has a little bit of effect on sneezing, things like that. Then the antihistamines will work. They're pretty safe. You can take antihistamines for very long periods of time, but it's always important to speak with your doctor if you're needing it persistently or you're using it a lot so that you can discuss the risks and the benefit of the medication.
We'll continue our discussion about allergies, particularly skin allergies. During this time, many of us worry about symptoms that might be similar to COVID 19. We'll be back with more right here on The Doctor Is In. Please stay with us. Welcome back to The Doctor Is In right here on CNN Philippines. Today's topic is on allergies. And this time, let's talk about skin allergies. Dahil may mga COVID-19 patients who have rashes. So we are joined today by allergologist Dr. Michelle De Vera. Okay, Dr. De Vera, rashes have been associated with COVID-19. How do we know if the rashes are an allergic reaction or a symptom of the coronavirus?
That's a little bit difficult to answer. In general, the nice thing about, well, it's not nice, but the important thing to think about with COVID is that there's usually a whole lot of other symptoms that go with the rash. So there could be fever, cough, headache, and then the rash. The rash of COVID there's different kinds of rashes, but the most common are red patches, um, not very itchy. And it can also be like little dots. And then the other thing that was shown in other studies was a really flaky, like a frostbite looking rash on the toes. So these are common rashes that were associated with COVID. The other thing that's important is that it's usually very acute. These are rashes that you've never had before. You're not a highly allergic person, and then all of a sudden you develop rashes with or without the other symptoms that we talked about, which would be the fever and cough and other respiratory symptoms. Allergies, on the other hand, are usually long-standing. So you usually are an allergic person. You've had this rash on and off for a very long time. And so that will be a big clue for allergies. But in the end, if you're not sure, then it's much, much better to go see your doctor to show the rash. And then it can be assessed appropriately.
Now, you described briefly how these skin allergies may look like, but how do we ease the symptoms, such as the itching and sometimes a burning sensation?
Right. For the itch, one of the things that you can do is to treat your skin well. The dermatologists like to advise us to make sure that your skin is well hydrated, that you put emollients, and that will help. Because the drier your skin, the more itchy it is. So if you take care of your skin, you use lotions and very mild soaps, that will be helpful. The other thing that you can do is you can take antihistamines if these are hives or welts. You can use antihistamines for that. And also, you can use topical medications. The most common topical medication would be steroids. Topical steroids can be given by your doctor, and then you can put a thin film over the areas that are affected. There are other medications that you can use that are not first line. So there are immunosuppressants that are topical as well. And there are also immunosuppressants that are in a tablet form. But those things you might want to speak to your doctor first. But in general, you can use antihistamines and topical steroids.
We'd like to read some questions from our viewers on Facebook. This one is from Monde Olinares. His question is, how can I make my rash go away?
I guess it depends on what the rash is coming from. So if it's an irritant, there's something irritating your skin, or you're allergic to something that your skin is getting in contact with, or you're getting exposed to, I guess that would be the first thing that you have to take care of. So take away the things that are irritating your skin or you're allergic to. So avoid those things. It depends. If it's a rash that it's infection, then you would have to use an antibiotic. So I guess, like I said, it would be dependent on what the rash is caused by, and then we can decide what we can do so that it will go away.
Mark also has a question. Let me read it. Are there home remedies for skin allergies?
I'm not sure what they mean about home remedies, but emollients are a first line thing that you can do. So moisturizing your skin is important, and some doctors and some experts have recommended, I guess, virgin coconut oil, like virgin coconut oil as an emollient. So I guess in a sense that's a home remedy if you want to use it.
Yes, and we also have a question from Belinda Castro. Ang sabi niya, are rashes a symptom of COVID-19? Dr. De Vera, napag-usapan na natin to kanina, pero sagutin na natin ulit for Belinda and also to remind our viewers.
That's correct, Freddie. So gaya ng sabi natin kanina, pwedeng rash ang symptom ng COVID-19. So if you have a rash that's acute, yung ngayon lang nangyari sa inyo, then it might be a good idea to see your doctor for it. Lalo na if you have other symptoms like fever or respiratory symptoms, it's important to see your doctor. Kasi pwedeng COVID-19 ang rash ang presentation.
Thank you very much for joining us, Dr. De Vera. It was really nice having you on the show. And it's always a good idea to know what you're allergic to. It helps prevent the symptoms. And especially during this time, we don't want to worry unnecessarily. Thank you for watching The Doctor Is In. We'll see you again tomorrow. I'm Dr. Freddie Gomez.